Hello, everyone. Happy evening, a very good evening. Welcome to our today's YouTube live session, which is a very, very special one because today here we have the recent FMG, that is FMG July 23 toppers here. Dr. Alikya, who'd got a score of 229 in FMG July 23, and Dr. Angad, who'd got a score of 221 in FMG July 23. And they have been, they've scored some amazing scores. And to tell you that, yeah, it is in their first attempt itself. So that proves that it is not as difficult as it seems. So that's why I have got hold of both of these basically to tell you all the tricks, that both of them used in their exam. And I'm sure that would help you in your upcoming FMG exam, which is on 20th of January, right? So before we go ahead, a quick nod. Let me also see the live chat and whether we are audible and visible. A quick check on that. Give me a minute. Yes. Give me a minute. Let's see any better. Yeah, are we audible and visible now, everyone? Still an issue there? I think, yes, we are audible and visible. So yeah, first of all, welcome Dr. Alikya and welcome Dr. Angad and first of all, thank you for sparing your time and helping the future aspirants, FMT aspirants here. I think it's a very, very good deed that you guys are doing, coming up here, showing up and sharing all your insights. What did you do in your last week and in the exam hall? Right. So without any further delay, we'll start firing the questions here to understand your strategy. So, Dr. Alikya, starting with you, please tell us what was your strategy in the last 1 week before the FMG exam. What should be done and what should not be done?
Yeah. So basically, I was in a mind frame last week that I have to study because I know that I usually remember the and like so I was also drained and exhausted altogether. But then again, I have kept on revising till the end of the. What my strategy was be studying those subjects that are more tricky in memory, right? Like memorization. I used to do it more for the last. I kept it for and also solving the test was that phase.
All right. So basically, if I ask you that, what subjects would you count in for that, like which are volatile and need the last
Yes.
minute revision?
Yes. So basically, I think NAT, I would say, and PSM, especially I did PSM on the last day. I think I keep on forgetting the vaccination and all the policy. Then also the clinical subjects, I would like in the earlier part of the week, first part of the week, start with it. And so biochemistry, I had to do it. I had kept all these.
All right, all right. So that's what we get. So first thing that we have learned from Alekia is focusing on the volatile subjects, right, which need immediate memorization and
Yes.
basically vomiting out in the exam. So keep it for your last days. That's what we have learned from Alekia. Over to Yangad. What was your strategy?
Doc, if I'll be honest, I would never suggest anyone what I did because like I was in a good sort of trouble in my own head. Like there is one thing which even you kept on FOMO, don't go on FOMO. So what was my logic was in the last 1 month I thought of I'll do the like I had done already around revisions already of every subject. So what I thought was that in the last 3 weeks I'll do it all over again. Practically, that's very like I can say it's not possible. And what I did, one very big mistake was, I still remember the 30th, the exam was there. So around 22, 23, like I had a planner with my, very important, to know that this many, this day, this many subjects to be done. And if you're not done with this subject, you can't lag on, you have to go with the next subject. It's very important to realize that we don't have to master a single subject, we have to know tips and tricks of all the subjects. So I had a very big mistake that I was studying all over again. I speak and study, so it takes me a bit longer as than usual. So it took me, I still remember, in the last 4 days, I studied Dharma for 8 hours for a whole day. And that was, I can't say it was a mistake at the end, because it did help, but then I got in a really big stress. I have to study medicine, surgery, OB, PSM. So what I did was that, on that day, I forgave myself with respect to the fact that, okay, I didn't waste my time. I was studying only. So then, we got all over together again to show that I will study faster. So the time management is actually very important. I believe that whatever you're studying, whatever is mugging, the formulas of physiology, biochemistry, and one more important thing I would like to emphasize everyone is, make sure that you're strong with the images, because this time in PSM, doctor can also tell us that key in PSM the images which were coming were like literally out of the box. So you should never ignore the images. What I did was that I kept the images for the last day, and at the end of the day, in the last day, it was full chaos. Like, go to another center which was 2.5 hours, and that was also very exhaustive. And then, yeah, the stress of, like, you have to get your admit card, you have to take your, like, one. You have the fear of, okay, what if you miss it? What if you get not be able to properly concentrate? So if even people say that there are 4 days to go, I would like to say that don't consider 4 days, consider 3 days to go. Plan your time according to that.
All right, so that was some great inputs that we have got, and I would actually agree to it. We tend to read in so much of depth, and then we get stressed out and panic. But I'm so grateful that you actually handled it so well, and I hope all the students there are as good as you to handle. Even if they do these mistakes, the best part is to get over it. Now, don't keep cribbing about it. Whatever time you have now, make the best use of it. That's the learning lesson that we learn here, right? Um, Coming to the next question, like most common query and that we see in this last week is, I'm not able to sleep because of the anxiety. Did you guys also face the same thing, Alekya?
Yes, definitely. I think I was anxious. I was like at the last moment, like I just want to pass this. So I just don't want to like score very well. I just wanted to pass. That's what you have in your anxious, and it's mostly like, what if nothing comes from what I have studied?
But
So
do you
it's like
think
that.
that's possible? I think we tend to overthink on that, like so
Yeah,
much whatever we have read in these days. I'm sure we tend to
exactly.
overthink in the last days. Yes.
Yes, very true.
So how did you cope up with that, the anxiety part of it?
So basically, what I used to do, I used to wake up and do yoga because my whole schedule was basically messed up with the, like, I was not doing a healthy kind of lifestyle while I was preparing for FMG. So basically, I just told myself that at least I have to do yoga in or meditation, calming, and for the entire day, you're just prepared more longer. And I think it's very nice that way. Also, I used to speak to my seniors as well who have already passed the exams. Some days it would be like a group call and they fire me that nothing wrong, just
Very
so it
true.
was
You
that.
need someone like that, to whom you can go and just vent
Yes,
your heart out and get that support. That's very, very important. How
definitely.
about you, Angad? How did you tackle the last day's anxiety?
Doc, meditation.
So did you
I
did you
actually
suddenly do it in the last week, or you've been doing it like
no,
since long?
Doc. Like, if I'll share a personal thing, 4 months back, 3 months back, when I was so stressed, because, like, one thing is that, like, even your friends, they want to support you, but at times, so they, keep on telling you, you're going to score good, you're going to score good. You're going to have that stress that, what if I don't score good? And it
Yes.
landed me up in the hospital, and I had to go and check an EC done because I had palpitation. So the doctor suggested me to start doing meditation, and that really worked. Thank God, like, I didn't spoil, like, last two. So I was very regular with meditation. Once a day, I would do it in the evening. I would, like, literally, it was like hell with the studies. Just go out, go for a walk, just have 20 minutes for yourself and come back, and that really helped. Doc. I would personally also say that if people are still, like, like, yeah, don't worry. Even though if, like some people are there, they'll try and still they'll not have the sleep. They'll say them it's okay. Whatever routine you're following, just do it. Make sure that you're going to be active and alert. And doc, I really feel one thing the adrenaline rush which what a person has at the day on the day of the exam, no matter how sleepy you are going to make it. Even I still remember that on the day of the exam, one day before I was so I slept that day at 4 o'clock in the morning on the day of the exam. It was very wrong. My dad and mom were calling me and shouting me, "Go sleep." That fear, as she rightly said, that stress of like what if I'm going to miss this? What if I'm going to miss? This? I was doing it. I took a risk that what if I'll. Everyone told that because you'll be lethargic and stuff. But personally, with my experience, it was I was not feeling was that rush that no, today's exam. Just hang on today. Just you can do it today. You can do it today. Let pass through that sleep. Then after that, I slept for 10 hours.
Yeah, yeah, true that, true that.
I might want to add, ma'am, that anxiety, feeling that fear is also very important part of the job to have it, because otherwise you're not, gearing up your performances. So I think it's very important to feel that during.
Yeah, true that. So, like we said, sometimes the stress is beneficial rather than being
Yes.
harmful. Yeah, but we should also know how to tackle that, right? Otherwise, it's really gonna be it's a double-edged sword, basically.
Necessary evil.
Yeah.